In early August 2025, Harlem, New York, became ground zero for one of the fastest Legionnaires outbreaks in recent memory. Within 5 days, confirmed cases rose from 22 to 58, and 2 hospitalizations ended in fatality. City inspectors traced the source to 3 municipal cooling towers, aged infrastructure that aerosolized Legionella pneumophila into surrounding streets. The speed of case growth triggered immediate public alerts. Health officials urged residents, especially those over 50 or with chronic respiratory conditions, to seek care for persistent cough, fever, and shortness of breath. Mobile clinics were dispatched to affected neighborhoods for on-the-spot testing. This cluster is not isolated. Similar rapid rise events emerged in Melbourne, where 8 cooling towers were decontaminated after 100-plus cases, and in Sydney's Potts Point, tied to a luxury apartment complex. The parallel timing of these outbreaks elevated Legionnaires' disease into a trending global health topic last week. The core risk factor remains aging building systems. When maintenance lapses allow warm, stagnant water, bacteria multiply and disperse through air conditioning vents and cooling tower plumes. These engineered environments, once seen as benign utilities, now carry renewed scrutiny under summer heat waves. Containment hinged on swift mechanical remediation, flushing, biocide treatment, and system redesign. In Harlem, the decommissioning of 2 towers and mandatory monthly water testing have been ordered. Local advocacy groups are pushing for updated building codes, while epidemiologists call for national registers of all cooling installations. Harlem's surge is a warning. Urban density plus decaying infrastructure equals a fast-moving public health threat. And as cities grapple with extreme weather and aging utilities, Legionnaire's disease may remain at the top of trending alerts until comprehensive reforms take hold. Legionnaire's disease is caused by inhaling aerosolized droplets containing Legionella bacteria, organisms that thrive in warm, stagnant water. First identified after a 1976 hotel outbreak in Philadelphia, its symptoms mimic severe pneumonia, high fever, cough, muscle aches, and sometimes gastrointestinal distress. The bacterium's life cycle involves environmental reservoirs like cooling towers, hot water systems, and decorative fountains. Without proper maintenance, temperatures between 20 to 50 degrees Celsius create optimal breeding conditions. Tiny water droplets then travel through HVAC systems, exposing occupants in adjacent buildings. Diagnosis relies on urine antigen tests and sputum cultures, which can confirm Legionella quickly. Prompt antibiotic therapy, typically macrolides or fluoroquinolones, reduces mortality risk to under 10%, but delays can be deadly. Public health guidelines emphasize routine water system monitoring, shock chlorination protocols, and temperature controls to inhibit bacterial growth. Importantly, Legionnaires isn't spread person to person, reducing pandemic-style panic. Yet its linkage to commonplace infrastructure turns everyday fixtures into potential hazards. Recent research also highlights genetic diversity among Legionella strains, some more virulent or antibiotic-resistant, underscoring the need for genomic surveillance. Urban planners and building managers now face technical and regulatory challenges. While federal guidelines exist, enforcement varies by jurisdiction. Advocates argue for uniform national standards, mandatory cooling tower registries, unannounced inspections, and public reporting of test results. As outbreaks pile up, from New York to Melbourne, both science and policy must evolve. Understanding Legionella biology is only half the battle. The other half lies in translating microbiology into robust infrastructure safeguards. As Legionnaires' clusters emerged, public anxiety and official measures spiked in tandem. In New York, community town halls filled with concerned residents demanding transparency. Melbourne's premier launched a 24-hour hotline, while Sydney's health minister ordered citywide inspections of all towers. Social media amplified both accurate advisories and misinformation. Verified accounts from health departments posted step-by-step guides on Legionnaires' prevention, testing kits, temperature checks, and building owner obligations. Yet parallel rumors claimed that showerheads were universally unsafe or that bottled water could prevent pneumonia. Falsehoods quickly debunked by infectious disease experts. Major news outlets ran live dashboards tracking case numbers, and journalists boarded service elevators to film inaccessible cooling tower chambers. Influencers posted instructional reels on wearing masks near air conditioning vents, well-meaning but only partially effective against aerosolized bacteria. Industry groups responded defensively. Maintenance firms offered discounted cleanup services, touting Legionella-proof treatments, some lacking independent validation. Meanwhile, tenant associations lobbied for rent credits, citing health hazard clauses. International health bodies chimed in. The World Health Organization posted technical advisories on Legionella control, and the Global Outbreak Alert and Response Network prepared to assist resource-limited cities facing similar risks. Public reaction has been a mix of vigilance and exhaustion. Urban dwellers, already wary after pandemic years, now worry about invisible dangers lurking in everyday buildings. But experts caution that overreaction, mass shutdowns, or panic sheltering can escalate economic costs without proportional health benefits. The global response to Legionnaires' clusters highlights a delicate balance. informing and protecting communities while avoiding infrastructure paralyzing fear. Legionnaires' outbreaks have catalyzed new policy initiatives worldwide. New York's mayor proposed legislation requiring all cooling tower owners to register with the city health department and publish monthly water test results online. Similar bills are under review in California, Ontario, and Victoria. At the federal level, health agencies are collaborating on a model code for cooling tower design, maintenance, and monitoring. This includes real-time digital sensors that alert managers to temperature or biocide concentration anomalies. Pilot projects in Singapore and Dubai are already testing AI-powered towers that self-flush when bacterial counts rise. Building industry associations are updating best practices. HVAC engineers now integrate ultraviolet C disinfection and automated biocide injectors into new installations. Retrofitting older towers is emerging as a multi-million-dollar market, with safety certifications becoming a competitive advantage. Yet challenges remain. Small businesses and heritage sites face retrofitting costs that can reach six figures. Local governments are exploring grant programs and low-interest loans to support compliance. Labor unions are calling for specialized training, certified Legionella officers who oversee water quality management in large facilities. Environmental groups warn that increased biocide use may harm aquatic ecosystems. They advocate for greener alternatives, copper-silver ionization, phage therapy, and engineered biofilms that resist Legionella colonization without toxic runoff. Ultimately, the policy push aims for layered defenses, stringent regulation, technological innovation, workforce training, and ecological safeguards. If successfully implemented, these measures could turn cooling platforms from hidden hazards into models of public health integration. The summer of 2025 may be remembered as the turning point for Legionnaires' control. As climate change brings hotter summers and more extreme weather, cooling systems will be under growing strain. Urban planners must now integrate public health risk assessments into building design codes and city master plans. Heatwave preparedness is converging with infectious disease prevention. Some cities are exploring open-air green cooling via rooftop gardens and shade canopies to reduce reliance on tower systems. Others are investing in district cooling networks that centralize water treatment and offer economies of scale for monitoring. Long-term, surveillance of Legionella genetics will inform vaccine and therapeutic research, though no human vaccine exists today. The pathogen's adaptability suggests that new strains could emerge, underscoring the need for continuous genomic monitoring. For building operators, the message is clear. Treat water systems as frontline medical equipment. Routine maintenance logs, digital alerts, and public transparency will become expectations rather than optional best practices. For the public, the lesson is vigilance. Know your building's water safety record. Report unusual odors, discoloration, or illness clusters. And during heat waves, prioritize well-ventilated or naturally cooled environments. Legionnaire's disease rising in trending lists is more than a headline. It's a signal that man-made systems require constant stewardship. The outbreaks of 2025 will drive a new era where infrastructure design, environmental sustainability, and public health are inseparable.